y'all ready to go? Wait a minute. Wait, come back. So the bangers of the banger of the gavel is William, and this is Wallace right next to me. And William told me that he graduated preschool, right?
All right.
You did, right? And that Wallace is getting ready to go into pre-K, right? You're a rising star? Yes. Is that right? So he is a rising star, okay? They've told me all kinds of things, okay, which I will hold against some of the people in the back. Okay, so anything else you need to tell me? Okay, Rising Star is the biggest class in the whole preschool. Okay, just letting you know. Okay, all right. Okay, thank you. Go with that man. He's safe. Okay.
Not really.
Not really. All right. We're glad that everybody is here today. Thank you, members of the council, people in the back. So we can go ahead and get started. I'm going to turn this over to Andronika Morris, who's the Executive Director of Housing NOLA. Ms. Morris, you are recognized.
Thank you so much. There we go. How about now? There we go. Good day, everyone. Thank you all so much. Thank you, first of all, Vice Mayor Schulman. Thank you for recognizing us and affording us the opportunity to make this presentation. As Vice Mayor Schulman mentioned, I'm Andronika Morris, Executive Director of Housing NOLA, and we have been engaged by the Mayor's office to do an analysis of the issues facing Nashville around homelessness and affordable housing and how those issues are linked. Today, we are thrilled to be here to present our preliminary report. This is going to take quite some time working with the people of Nashville, working with all of you to support y'all in this. But given the extraordinary set of circumstances the people of Nashville are facing, particularly with your homeless population are facing, it was decided that we needed to make a preliminary analysis of the existing systems as quickly as possible to guide some initial recommendations and in order to guide further integration and engagement with various bodies, everyone from the Homelessness Council to the City Council to community leaders who are not actually participating in this crisis, in addressing this crisis. And so that is what our recommendations today. We're going to talk about the strengths, the many strengths of these systems and the shortcomings and the opportunities to move this forward for the people of Nashville, for you all to move this forward together, and how that looks and what that looks like. So I'm going to an overview of our agenda, our presentation. We're going to do the scope of Nashville Phase 1 report, again, including strengths, areas for improvements, the data-driven recommendation, that's something that's very important, some notes, and then we're going to open it up to questions. And without further ado, I'm going to turn this over to my partner in crime, Stacey Horn-Koch, who's been on the ground here in Nashville with you all for many weeks and months, discussing the issues here and helping us to form these recommendations. Stacey?
Hello, good morning, good afternoon, everybody. Thank you for coming. To those of y'all in the room that I have spoken to, thank you so much for the information you shared. I did speak to over 40 people during the process of my work here. A number of them asked to remain anonymous because they gave me feedback, and I'm going to honor that, but I do have a list of the people that I spoke to. And so I would like to start by saying I think Nashville has some very passionate people who are very motivated to assist those who are vulnerable, who are in need, and to move people off of the streets and out of shelters and into housing. And so I think that is really important to acknowledge. because I also need to talk about the fact that we have a tremendous amount of room for progress. There's a lot of progress that can be made, and one of the things that we'll be talking about today is kind of revamping Nashville's homeless response system in order to better address chronically homeless. And to do that, I mean, there are structural hurdles, they're all outlined, but a lack of, or the need for more coordination, the need for clear leadership, clear unified leadership of all areas of the continuum, the collaborative applicant and the lead agency in order to work with all of the agencies that serve the homeless. This is the funded and the unfunded, HUD-funded members of the continuum of care. And so we really need to unify everything so that there aren't siloed things happening. So that is one of the major recommendations. The other recommendation, and I don't want to get ahead of myself in the slide, I'm a little ADD, so I tend to really make it hard for whoever's flipping the slides while we're working. But we have recommended that Nashville adopt a housing first approach. And there is nobody better in the world to talk about a housing first approach than Dr. Sam Simbaris, who is, I don't know whether you want to be called the father or the founder, but this is the man that made it all happen. I was lucky enough to meet him many, many years ago, I think in almost the beginning of when you started Pathways, and I had the opportunity to sit in on one of his case management sessions, and I don't know if you remember that, Sam, but it was eye-opening for me and informed a lot of my work moving forward. So I'm going to turn it over to Sam Simbaris just to talk about Housing First
Okay, so okay.
All right. I've already messed up the slide thing, just so you know.
So, Stacy, while we're switching over the microphones and figuring out the slides, I would like to recognize that Mayor John Cooper is in the room. He's in the back. All right. Thank you, Mayor, for being here. Sam, I believe it's your turn.
All right. I'm going to go to this slide.
Just a definition of housing.
Just a definition. Good afternoon, everyone. Thanks very much for being here. I'm honored to be part of this work group and part of this initiative to move Nashville towards becoming more of a housing first city and taking a housing first approach. Housing First is essentially a program that requires permanent housing, whether it's in the form of developing housing, or in the form of Section 8 vouchers or any other HUD rent subsidy, plus services. One of the misunderstandings of Housing First often is that it's housing only, but Housing First as a program actually starts with services, and among the services offered is housing. So the entry point to the program is a commitment to that person to help them in whatever way they need to. Typically, when they're homeless, they need housing first, and then we provide the supports. I'm going to stop there. We're going to get back to this in more detail.
I just couldn't mention Housing First without having Sam chime in. So as of the January 22 preliminary PIT numbers, there are roughly 1,900 individuals in the city experiencing homelessness. Of that, 634 of them live on your streets or in places not meant for human habitation. That number is has actually grown somewhat. And then we do have, of the 1,900 people experiencing homelessness in Nashville, Nashville, there are 492 individuals, and that is a small decrease, but essentially Nashville has not been able to move their numbers on chronically homelessness. And truly, if you take a look at the chart, the movement that has occurred for just overall homelessness in Nashville has decreased very little. I mean, you see a little bit of movement, but nothing of it is very significant from 2011 to now. And a lot of that has to do with the fact that Nashville has, to some extent, been concentrating on housing people who are not the most needy, who are not the most difficult to house. Some people call it creaming. I'm just going to describe it as targeting those of lowest need and moving them into housing. The problem with that is that most people with very low needs can essentially move themselves out of homelessness if given enough time, and usually in between 3 to 6 months they're able to move themselves out of homelessness. And so the targeting of those individuals over people who have vulnerable mental illnesses, physical and behavioral health, substance abuse disorders, is that those people tend to remain on the street. They get sicker and sicker. And so they become more and more difficult to house. So the way to effectively move your numbers in homelessness is to start addressing the chronically homeless, and to do this collaboratively across systems, to create a narrative of inclusivity, to create a collective impact group, so to speak, to really focus on and address the chronically homeless while still paying attention and having it's kind of like tracks that cross but intersect, because you need to concentrate on the homeless, but you need to have a strategic plan and target the appropriate resources towards those who are not chronic. We want to keep paying attention to youth. We want to keep paying attention to family homelessness. And most importantly, we want to keep paying attention to the front door of homelessness. So we talk about housing people who are chronics and moving them into housing, and that is an absolute necessary thing that we need to do. But we also need to be able to watch our front door effectively, and we need to coordinate all of these efforts so that we are not wasting a single resource that we have. Have I totally messed up the? Okay.
No, sorry.
Okay. What's?
Yeah.
So we actually put a chart together for you guys. Currently, or as of the 2020 point in time hit count, or all of HUD's data, we don't have great data from 2021 because not every state did a full count, and HUD has not released its report on 2022. So what we did was work with, and I have to attribute this work to Greg Shin, and he sent a shout out to Susie Tolmay and Richard Rankin for helping him pull all of this data together in the whole study. But so we pulled data from other similar cities and looked at cities that had moved the needle. Some of the cities are of similar size. So as you can see, Nashville has a rate, their percentage of their homeless population that is chronic is 26%. The national average for chronicity is 19%. In cities where they have really spent a lot of time targeting the chronically homeless, and just recently Philadelphia and Milwaukee made a concerted effort, and those cities have kind of moved below. Milwaukee, on this particular graph from 2022, shows 73 chronically homeless people in their whole system. They presented at the Housing First conference that we attended in Seattle, and Sam, I believe their actual count for 2022 looks like it's going to be about 17. So that just shows what can happen when you really target chronically homeless people. So we will continue to delve into the data and report on where we stand, and we look forward to getting more data from HUD once it's released. So, do I have a next slide? All right, so obviously, in order to house people, you need not just housing subsidies, and you need to not just use those subsidies strategically, but a very wise woman a long time ago, a woman by the name of Mercedes Marquez, who was an assistant secretary of HUD, told me at the end of the day, the real answer to making sure that your homeless population doesn't continue to grow is having a readily available supply of affordable housing. So there is a connection between affordable housing and homelessness, and they need to coordinate, but they are two separate tracks that intersect. And so that's gotten much harder in Nashville. And so we need to build capacity in so many ways here in Nashville, not just in supportive services, but also in bringing more partners to the table, more multifamily developers that are willing to work with us on affordable housing. I've actually managed to talk to a few in just this very short period of time that are willing to work with us, so that is encouraging. Andronika did a deep dive into affordability in Nashville, Davidson. I think they're talking about how far I go off of the slides.
Yes.
Okay.
Should we go to the recommendations, the data recommendations?
Well, we still haven't talked about the strengths yet. I mean, I do think this is a challenge that we're having, because we want to make sure that you all hear everything, but we do need to make sure that we stick to the
PowerPoint. Got it. Okay.
Because it has all of the information there.
Okay.
It's just we got to stay on track. So,
Okay. A need for affordable apartments.
yes. And now we need to talk about, because we do need to talk about, Stacy has just laid out the various challenges, a deep and insightful analysis of your issues, but there are strengths here, and so we want to make sure that folks hear that as well.
Right. So the strengths in Nashville are that the Continuum care has so many passionate stakeholders. That's beyond a shadow of a doubt. I think there is wonderful, effective communication between the Metropolitan Development and Housing Authority, MDHA, Metropolitan Homeless Impact Division, the Metro Nashville Planning Division, and the Department of Social Services. Your housing authority dedicates 18 housing choice vouchers a month to homelessness. That is an incredible commitment that I cannot even express to you how many homeless COCs across the country would love to have that kind of commitment. And if used strategically, they can move the needle very quickly. Also, that's very important to mention as a best practice is the creation of the Low Barrier Housing Collective, the Landlord Incentives Engagement Fund that is funded by ARPA funds and I think the First Foundation, but that is an unprecedented, it is a national best practice. And if you look at all of the cities that were successful in ending veterans homelessness, that were successful in really decreasing their chronic homelessness, all of them had this type of system to help bring landlords on and, create funds that make it more attractive for landlords to participate, and I'm going to add, bring in multifamily developers, because they're some of your low-hanging fruit. Those guys are busy building here all the time. Okay, I'm sticking to the... All right. The thing that one of the areas of improvement that I've already talked about was the continuum of care, the lack of prioritization of chronically homelessness. Currently, the resources are not directed towards chronically homeless. Most short-term homeless people can and would have solved their homelessness without intervention or with minimal intervention. Currently, only 26% of the households placed into permanent supportive housing in Nashville over the last 5 years have met the HUD definition of chronically homeless. And just for those of you who do not know, HUD defines chronically homeless as an individual with a disability who has lived on the street or in shelters for 12 months or more, or who has had 4 distinct episodes of homelessness that total 12 months over the last 3 years. And so that is what that is what the definition of chronically homeless is. Other areas of improvement are the continuum of care, the HPC. The governing council is not currently organized for effective governance. The strategic plan as it stands right now is very broad without well-articulated, data-driven strategies. And also with that, there need to be outcomes and activities linked to those outcomes and who's going to be responsible. Because at the end of the day, and I know I'm getting ahead of myself, but I will get back to this slide, we need to know who has the authority, who has the responsibility, and most of all, who can the citizens, the city council, and the mayor hold accountable for any progress made towards goals or not. We do not in Nashville currently have a good amount of housing for supportive services. If you're moving chronically people off the street, these are not people that need a once-a-month phone call in order to get case management. These are people that need to be seen at least monthly, but some of them need to be seen weekly. Really good, effective housing for supportive services, our ACT teams, ICM, partnered with some real peer support in there. And the other thing that I think Nashville has some areas where they can improve, because I know that there's lots of grants that flow around out there, but we need to braid all of our funding streams together so that we can make sure that they are effective at serving the people that they can serve, and that in a way that reserves the HUD resources for those that need them the most. All right. In its current structure, the Planning Council is cumbersome and is really not effective for collaborative and effective governance. Over the last few months, I think things have gotten worse, and I can tell you that every single member of the Planning Council, people outside of the Planning Council, all mention this. It's not effective, and it is and everybody wants to know what their job is. And so I haven't sensed that people are closed. I think that they are frustrated is the word that I will use. I do find that the HPC focuses on managing Metro staff and could be more effective in rallying the community. Later on in the report, you'll see some recommendations that really require some strong advocacy that could really address the chronic homeless, fundraising, and the implementation of best practices, training and implementation of best practices. The HPC lacks diversity, inclusiveness, and a racially and trauma-informed lens to do its work. This, I have to tell you, for me, was one of the most startling things that I heard. Of late, in the HPC meetings, people, and I heard this from people both of color and not of color, are traumatized by the amount of aggression in the meeting. If you are familiar with trauma-informed care, then you would understand that often when people become aggressive or even have microaggressive bursts, it is re-traumatizing for many people who have been the victim of racial or social trauma throughout their lives. And so I think that it's very important that I call it out. This was probably also one of the most uncomfortable things to call out, because nobody likes to hear that. But in order to heal, in order to change, in order to move forward, we really need to look at this through a lens that looks at racial equity, that looks at consideration for people's feelings and for the past traumas that almost everybody has had in their lives. So in a city that is 28% Black, 10% Latino, the 25-member council should have at least 7 African Americans and at least 2 Latino members to match the demographics of the city itself. I think in a later slide I show you that the homeless population is considerably more than that. And so if the council were to match the demographics of the people that they are serving, which are 46 or 42%, it's in the later on, African American, and 10% and 5% Latino, we would really need to make some changes in the diversity of the Homeless Planning Council. Currently, there are 3 people of color, 2 African Americans, and 1 Latino that are on the council. I do know that I was told that when the meetings became more heated, 2 of the 5 African Americans that were on the board resigned, and then 1 African American moved into a job at MHED and was no longer eligible for the council. I do know that we have been trying to recruit African American memberships and members and Latino members, and there is a hesitancy among that population to join because of a fear of a lack of safety and ability to speak openly in meetings. So I think I'll move on now to the data-driven recommendations, and then I'll be quiet and let Sam speak, because he's also much better at following the PowerPoint apparently than I am. But there is an overwhelming need for us to prioritize the chronically homeless, allowing Nashville to bring together government, nonprofits, business, correction, everybody that is connected. I'm getting okay. Sam, I'm going to let you speak on prioritization, and you can particularly talk on more on how it's moved the needle.
About the implementing the Housing First model?
Yes, please.
Well, I guess the question is, why would we want to implement a Housing First model? And Stacy
Hey, Sam,
referenced.
Sam, if you don't mind, get a little close to the microphone. I think people are
Okay.
having trouble hearing you.
Is that better?
Can you all
Sorry.
hear? Can you all hear in the back? Okay, thank you.
Well, we might ask, as Stacy mentioned, why would we want to implement a housing first model? So maybe it would be useful just to address that for a moment. When she referenced Milwaukee, it's one of many places around the country that cities or organizations have adopted a housing first model, and this is not a matter of persuasion or goodwill. The model is based on evidence. There have been randomized controlled trials conducted all over the United States. Recently, the Center for Disease Control in 2020 published a summary paper of 26 studies, and the overall housing retention rate using a housing first and then treatment approach compared to a treatment sobriety first and then housing approach was 88% compared to about 40%. So this is not a small difference we're talking about. We're talking about a program that is well described, well documented, and proven to be effective across many areas. I mean, in the area, for example, of veteran homelessness, where the VA has taken a housing first approach in their HUD-VASH program, if you look at the data on the U.S. Interagency Council website, 83 cities in the country right now have ended chronic veteran homelessness, and moving to chronic. So the examples are there, the data is there, and that's why we're pushing it. The problem with Housing First is that it's difficult to run. You know, you need, and there has been historically in Nashville efforts to operate housing first programs, but people have run into difficulty in braiding the housing support subsidy with the support service subsidy. So then they're left with people who have active problems and not enough support to make sure that people are looked after and supported in maintaining their housing, and so the thing has not worked well. And generally, as a community, Nashville has moved away. There are not many, in our findings, housing first providers here. So that's you know, the issue that I think we're trying to address. How do we bring an effective program in order to address this chronically homeless population? Do you want to go back to the other recommendations, Stacey, or do you want me to continue here?
Where are we on that?
Did this one? Did that one?
Oh, so one of the things that we are recommending is a standalone Office of Homeless Services. This office would report to the mayor and be appointed by the mayor, but appointed by the mayor from a pool of vetted candidates that meet criteria for being for the job. I mean, it can't be it'll be an appointment based on vetting and a national search, as we have going on right now for an executive director. And I know that there have been questions about having that person report to the Governance Council, which I do not think is a good idea. Currently, the Governance Council needs a tremendous amount of training on governance, on equity, on trauma-informed leadership, on a number of things. And also, I don't think that there's any evidence that having a HUD Planning Council choose a city employee. And within Nashville state government, you have a number of response systems, such as the Office of Family Safety and the Office of Emergency Management. They are all emergency response systems, and they they're vetted through human resources at the city level. It has to be a qualified pool of applicants, but they are chosen at the city level because they are city employees. And right now, I will tell you that the mayor or the city of Nashville, because it's been going on for quite some time, does make a significant investment from their general fund in paying for employees that work on homelessness and that basically coordinate the efforts of the COC.
And do you want to show the PowerPoint?
Okay, so this is a PowerPoint that shows what it would look like, the reporting structure. I mean, it's just a very basic outline, but this would pull together the collaborative applicant from MHED and put everything underneath one executive director, a very seasoned leader with experience in working with HUD, with experience working in continuums of care, with experience leading change, with experience getting consensus from a diverse group of people. And this person will also ultimately be responsible for how well the needle moves. And this person will have to work with the Planning Council to monitor, data and to watch the performance and make sure that we are actually moving the needle here in Nashville. And that is something that has been somewhat lacking because, as you could see by the first slide, the needle has not moved significantly over time. So I'm also recommending a restructuring of the Planning Council. My recommendation would be to downsize and restructure the HPC to make it conducive to good governance. Currently, they have 25 standing members and 14 committees. And that could be pared down to between 17 and 19 standing members. New leadership is needed to provide a clear understanding of governance and the role of each HPC member. A number of the HPC members made it clear that they really didn't know what their job was, or they felt that their job was something other than would be part of good governance. So, in the meantime, I understand that would require legislative authority. In the meantime, I would certainly recommend that we take a look at creating within the HPC something called the core management team that would work to make sure that things move forward. So one of the jobs that would normally be of the HPC or the Governing Council would be to hold the executive director and the strategic planning committee and the data committee, hold them responsible for making sure that the changes needed or the data was being entered correctly, kind of to monitor the whole system with the executive director to make sure that things are moving forward. I also think that by restructuring and reconfiguring with a lot of training is that the HPC can be more effective at building will in the community, at working to advocate for the things that need to happen on a state level in order to make the system viable. I think I'm jumping ahead to one of my other recommendations, but since I've already done that 1,000 times, I'll keep going with it. One of my recommendations is because Tennessee housing first supportive services to be given, one of the things that we could advocate for are for two waivers. One is a 1915I and the other is a 1915C. Currently, the state of Tennessee has one waiver. It's an 1115, and that's a great waiver. It is a waiver that allows for expanded services for individuals with developmental disabilities and cognitive disabilities, and it's absolutely needed. But it is absolutely essential that that we be able to serve those with serious and persistent mental illness, people with substance abuse, also provide some of the services that are possible under these waivers to support people with physical disabilities as well. So it's important. Those are a few of the things that a well-organized council could work on. They could also be advocating at the state housing level for the inclusion of deeply affordable housing in the QAP, which is the Qualified Allocation Plan. Tennessee is one of the few states that does not include permanent supportive housing in their plan, nor do they incentivize the development of a very low affordability for people who are at 30% of AMI. Really, I don't know that they incentivize anything below 60% of AMI. So those are two important things that can make an immediate difference in Nashville and Davidson County is to have that happen. Where am I? Okay.
And data collection.
All right, so the other thing that we looked at, and Sam's going to go into it in more detail, but there are, I have it in my hand, but there are there are a lot of holes in the data. And in talking to people, a lot of people said, well, you know, I mean, the mission doesn't enter, which is a faith-based shelter in the city, and they don't take HUD money, so they're not required to enter. They are very willing to work with us to give us the data. They are not the biggest hole in the data. What we have found is that we really need to pay better attention to documenting things that will show HUD how we move the needle. And those things are location prior to entry, the length of time homeless, the disability status, all of these things documented in HMIS lets us show HUD what we are doing, how well we are performing. And I also believe that to some extent, people don't want to do it because it's onerous. I mean, it's not fun, it's a pain, and they feel like it's something that's mandated from HUD, but we collectively need to do more training to show them how a really well-run HMIS system can actually help them raise money, that can help them show people that they are trying to apply for grants from, et cetera, how they can move the needle. And so we just, I think that we need to incentivize the inclusion of all programs in HMIS, those that are funded through the Continuum and through our entitlement programs, as well as those that are funded through other sources, because it's important that we know all of that. Once again, we're talking about a whole system and how it performs, and so you have to know what you have out there.
So now, Sam.
Okay. Well, to summarize that piece, which is why are we focusing on people who are chronically homeless? 493, it's been pretty much the same over 5 years. The data methodology that Greg Shin used to put these graphs together that I'm going to show you looks at a 5-year period from 2017 to 2022 and uses the data of what's happened in the past 5 years to project forward what can we do in the next 5 years in order to solve this problem. The good news is that 493 people is actually a small number of people. And Stacy has already mentioned that there's 18 housing vouchers that the housing authority is willing to issue every month. This problem could be solved in 2.5 or 3 years. So that's where the data came from, and I'll tell you what the data says. And some of it I know you've already heard, which is the placement rates by quarter. This graph on the left looks at just the overall activity level. There has been a lot of housing placement in Nashville. Over 8,531 people have been housed in the last 7 years, but the percentage of people housed is small, of the chronically homeless is small. Why that sets you up in a kind of a vicious circle is that HUD, that is funding from, Washington down to state, to city, to local COC levels, looks at the HMIS data, the National Housing Homeless data, and that's how they allocate funding. You, as a city, are getting much less than other comparable cities from HUD because you are not reporting that you're housing the chronically homeless, which is HUD's priority. So that's why it's so important to focus on this particular group. It could almost double your revenues if you are targeting the right group and housing them, and you would be able to apply for HUD. Yeah. So the focus on the housing has been on another product called rapid rehousing. And rapid rehousing is basically rent, and sometimes it's 6 months or 3 months or 9 months, depending on the program. But that program, as effective as it is and as many people as it has housed, does not bring down your chronically homeless numbers, because you can't really house a person who's chronically homeless in rapid rehousing with rent only and no case management. So there's a lot of activity going on, but it's not moving in a direction that reduces your chronic number and brings in additional funding. The specifics on that is, in fact, the permanent housing over the last 5 years has actually decreased by 9%. There are today, in 2022, 127 beds of permanent supportive housing, fewer than we had in 2017. While the rapid rehousing, that short-term rental stipend, has increased by 656%. So much of the money and effort has been going into housing that group among the homeless that needs a quick rent fix, which is great, but it doesn't, solve this other problem. If you're not increasing your permanent housing supply, you're going to have a difficult time placing people in housing that doesn't exist. So that's how these two things are linked. We have to increase the supply. The supply could quickly be increased with the vouchers I mentioned, or you could build, but you have to have more supply in order to have more placements. And the challenge of the services, I know there's in the mayor's plan some money for initial startup of additional support services needed to actually implement a Housing First plan. So that's what our focus needs to be, and the drop-off in placements from 2017 to 2022 has gone from 30 people per month to just 7 per month. So I'm not sure exactly what's creating that, but that's quite a drop in placement activity over that same period of time. The next slide is about point-in-time counts, the annual. What it shows, if you look at the orange dotted line across the top, that's the number of permanent supportive housing slots available, and that has, as you see, slightly decreased by 9%. And then the dotted green line shows you the number of people who are chronically homeless, which has essentially remained the same. Okay, forecasting, what do we need to do? if we increase the number of permanent supportive housing beds, either through vouchers or development in any other way, but the vouchers are readily available, I would encourage that. If we increase them by 9% each year, the numbers on the right show you that we would be able to house 110 people in the first year, 120, 130, and 142, each of the succeeding years. These are actually estimates based on previous activity. If you actually utilized the 18 per month vouchers, that's 216 vouchers a year. You could do this actually in 2.5 years, because all you need to get to is 500 in terms of the current number. So, the resources are there for housing. There, and I think Nashville can do this.
All right. So we're going to go ahead and wrap up because we started a little bit late, and we want to make sure we give the council a chance to ask questions. So you all will be given a copy of the report. You can access a copy of the presentation if you like as well. And I do want to reinforce what Sam and Stacy just talked about, is that this is possible for the people of Nashville. The data that we've gone through actually demonstrates that Nashville has all that it needs. This is a will issue. Will the people of Nashville, will its leaders step up and do what is required? And we certainly hope so, and we think that you are ready to embrace this challenge. That's why we're here to help you and support you, but this is something that you all will be doing. So we're going to open it up for questions right now.
Ms. Morris, real quick, where can the council and people in the back get a copy of the slides?
We're looking at...
It's going to be posted on MHED's website.
Oh, okay, it's going to be posted on MHED's website? Okay, so everybody can get access to it. Metropolitan Homeless Impact Division, okay? So...
we'll make sure we follow up and send everybody
trying to make sure that we...
a link.
So do we know what the actual website is? April, Renee?
Can we just follow up and send all the council members a link?
Okay, but I know there's a number of people in the back who are going to want that as
And
well.
all the
Harriet,
folks in the audience.
if you come to the back podium, and then I'm going to... if you could just give us the website so everybody can get access to it, that'd be helpful.
The particular page where the report will be posted, we'll have that sent out to the entire council so that they can access it as soon as it is all uploaded. So that'll be sent out to everyone so they can review it.
Okay. I think
And the general public.
And the general public, that's...
And the general public as well, of course.
Okay.
Yep.
All right. Councilmember Allen?
Thank you, Mr. Vice Mayor. Thank you all so much for all the work you've done on this, and it's exciting to hear somebody say we can do this, because we need to, and we definitely want to. A couple of questions. I know that we have a vulnerability index that takes into account issues. I know it deals with health, perhaps, but I guess what you're saying is it's a different set of criteria from the HUD criteria?
No, it's not a different set of criteria. I think that a lot of communities nationally have used this VI SPDAT index, and that instrument, I mean, recently we've been using it for a while, and there's been some research on it, and it's not a useful instrument. It has no validity or reliability. It actually discriminates against African Americans, especially women. That's what the study found. It was actually done here in Tennessee. And anyway, we need some way of prioritizing people, for sure, but you can use the HMIS data, the federal data, to get the homelessness time period, but you can also use real data like outreach input, administrative data in terms of hospital or police contacts. I mean, the committee can come up with a number of criteria that will prioritize the group that you want to house, rather than rely on that one self-report checklist.
Okay, so is there a standard? I mean, apparently we thought we had a good list, so to have us
No,
come
I
up
think
with another
everyone
list
thought-
that we think is a
yes.
good list may not necessarily get us there. Is there a standard set of questions that we should be looking to?
I think there's a lot of people working on this because this just is happening now, and a lot of
Gotcha.
communities are moving away from the VI-SPDAT and developing a way of coming up with that methodology. I think everyone wants a quick answer, but, you know, it's going to be a little bit more complicated, and we'd have to actually spend time talking about the people.
Okay, so that's just something we look to
Yeah,
our
yes.
peers for.
And Beshin here at Vanderbilt just wrote an article on, other ways to do that. And so
Right.
there are a lot of really smart people looking at how to make it better, how to do it right.
Okay, that's helpful information. And then we certainly have been working and providing resources in fits and starts toward making our HMIS system more robust. And I know a big part of the issue is getting the partners to all fill in the data.
Right.
And I think what I'm hearing you say is when partners don't fill in the data, that hurts
It
everyone.
costs you.
It costs us.
Yeah.
So we just have to work on that. And then the other one is, yes, we have lots of vouchers, and we simply don't have the landlords who are willing to accept those vouchers. And I know that there's some great landlord support programs that we're beginning to use. Are you seeing evidence of success that here in Nashville, or?
That's a problem also that's happening across the country, and that's why the affordable housing production section is so important, because you're going to have to create the units and the opportunities to meet that resource that you have. Part of the reason that resource isn't being properly utilized is that you have a disconnect there, and so there's also a real need to make some real investments around production.
Gotcha. And what I hear you saying, though, is that that's not necessarily a part of this division. I mean, as you know, we've just created a division of housing in our planning department, which we're really excited about. So
yeah, that's going to be a unified housing plan that y'all are working on. That's something that we want to make sure is properly integrated into this process. And so, yeah, you do have a lot of the things getting ready to be moved forward on. And so, yeah, it's also part of our recommendations that the unified housing plan be integrated into this process, and vice versa. As Stacy mentioned, there needs to be a clear line of who is doing what and who is doing what where, and then where they integrate and where they taper off.
Right.
Because it can't all be housed in one single place. The system is much too diverse, and it's too bleeding amorphous for that. But you can ensure proper integration and proper coordination, and that's what the recommendations that we put together would help y'all do.
We need to make sure that it doesn't become a siloed office, but instead it is a person. It's like an orchestra leader,
Gotcha.
Waving the wand and pulling everything together to, each different line of a melody to create a full symphony, so to speak. And then I do want to speak, the mayor's recent dedication of $50 million to homelessness is not just unprecedented, but the one part in it, which I think is really creative, is to dedicate $25 million to bring on units that will be more readily available through a gap financing program, and that will create program income that can continue to be reinvested in homelessness. We spend a lot of time making grants, but when you are using federal money and you have a great partner like MDHA, and you can create loan programs that create program income to assure that there's at least some money that continues to go back into the system, it's a really important thing to do.
May I just add a small practical point to this is these are long-term plans in terms of building and development. I think right now, practically, with this kind of low barrier landlord incentive program, landlords need to be considered as partners in the solution so that if the voucher is below market value, we need to up the value of the voucher. So it's 120% of what HUD thinks is FMR, but also indemnification of damages, payment of security deposits, and even landlord incentives, so that we can start this like next week rather than, like there's that short term, and there are apartments available. It's a big city, so that we can start with that and also simultaneously pursue the long-term strategy.
But that's what the local money is used for, to make the HUD money usable.
And we actually have, just in the last 3 weeks, made contact with 2 multifamily housing developers that are already ready to work with us. So I think, putting the will out there makes everything more of a possibility.
All right, I've got Councilmember Hurt and then Councilmember O'Connell. Councilmember Hurt.
So, thank you all very much for being here. I keep hearing that we can start and work with us. Do you already have a contract?
Yes, ma'am.
So this is going to be, you're going to implement a homelessness plan for the city of Nashville.
We're going to assist you, yes. We're going to assist with some of the implementation of the recommendations.
Oh, okay. I guess I must have misunderstood that. I thought it was just for the study. Am I incorrect with that, Vice Mayor?
So I think this may be a question for the administration, but there was an initial review based upon working with Councilmember O'Connell to do an initial study. But it's now my understanding that the study continues and they continue to work with the city. But I'm going to turn it over to Ms. Wilson for an answer for that. Hold on.
The original contract that was authorized by council had 2 phases in it. A first phase was a 12-week evaluation and performance review, which this is the readout against. And then there's a phase 2, which is implementation support against the recommendations, because we recognize that there would be work to do, and we wanted expert guidance as we effected that work.
Okay. So, you saying that the homeless team and our current custodian of our homeless project are not experts and they are not qualified to do it?
I don't believe that this was to bring in supplemental national expertise to look at different types of ways we can improve, and to bring in folks who have seen this and implemented it on the ground to help us do so. This is not meant to be pejorative towards any aspect or stakeholder in our system overall, but a recognition that when you bring in evidence-based practices, that often bringing in people who've been practitioners of those to help us is a good idea.
And I would agree with that, but I think that some of the things that we've seen over the last couple of 2 or 3 years is evidence-based. And I would ask you all, in terms of the priority and the accountability, how important is that from on a scale from 1 to 10? Because, we've been dealing with this homelessness for quite some time. And so I know for me, it's been early 2000s, and here we are in 2022. So I'm just wondering what you all think as experts. how much of it has to be a priority in order for all of this to work, and the accountability aspect of it as well. And I think also the engagement of the community and population that we're serving, because I'm not sure that that has been a part of the total assessment and evaluation.
So let's we might want to recap a little bit, because we did make assessments on those pieces, and we talked about early on, and I do believe, Councilwoman, that you missed that piece of it, that we talked about the fact that there's a lack of representation and diversity in the current infrastructure.
I think I heard you say it was.
Yeah, it currently is.
Right.
And you just talked about the fact that this is a long-term problem, and what we're talking about is that there is a way of solving for it. Again, sometimes there's fatalism when it comes to these kind of supportive services programs. We hear people say things like, the poor are often with us, are always going to be with us. And what the Housing First model entertains is that things happen, crises happen. Can a community respond to those crises and see to the needs of their most vulnerable, instead of shrugging and saying, well, the poor are always going to be with us and there's nothing we can do for them? And so Nashville has decided to embrace that and has asked for help in envisioning and implementing a version of itself where, while the poor will always be with you, the people of Nashville, this community, will respond to their needs thoughtfully and effectively and supportive. And what we've done so far is look at how there has been a lot of investment, there's been a lot of energy, and where it's missing the mark, and how those things can be changed so that the people who are slipping through the cracks we're not just shrugging and saying, well, the poor are always with us.
Well, I'm of the opinion that the design is for there to always be poor, because as long as they're always poor, then that means that there's always rich. And if our focus is always about making sure that people are continuously being rich and getting rich, then we're going to always make sure that people
somebody else is poor.
Yes.
If it's in a zero-sum game, you're exactly right.
Right, and that's basically the history. So I just want to speak on the accountability, how important that is.
So it is important, accountability and authority, responsibility, and accountability. The importance of those cannot be overstated. And I think that you've had a siloed system for a very long time, and there has been no unified leadership of the homeless response system for a very long time. And so, you need all of that to kind of, we're basically recommending that you revamp your homeless response system, and that we move into evidence-based best practices, that we target those that are hardest to serve, and move the needle by serving people who most need our help, and by not giving everybody the whole enchilada, but by strategically targeting the resources to meet the need of the person. And you have a plethora of agencies out there that want to do the work. And I just think that there may not have been as effective a coordination of those efforts as Nashville needed, because Nashville's full of great people that are passionate and want to serve, but there's been no overall coordination based on evidence-based best practices, and to some extent not even on HUD guidance as far as moving the needle forward.
Councilmember Hurt, I want to say, in terms of prioritization, I think that is key. I think that unless we prioritize, we're not going to focus on the group of people that we want to end homelessness for. So that's absolutely essential. And I would also say that the leadership and accountability piece is part and parcel of that. As far as the inclusion of people who are actually experiencing homelessness, being all inclusive, I didn't say, and I should have said, that the whole Housing First movement is actually the result of listening to people who are homeless, because when we asked them what it was that they wanted, it was housing first that they had informed us with. So it's baked into the program to be very inclusive of the people we serve.
Thank you very much. That's exactly what I was looking to hear, because the people that you speak of, I've given my life's work to that. And many of the homeless people are homeless. They're not helpless, nor are they hopeless. And we have to treat them as dignified individuals as they are. And I think that it has to be our priority to make sure that it works. And that, to me, is what has been missing.
Thank you.
All right. Thank you, council member. Councilman O'Connell.
Thank you, Mr. Vice Mayor. And thank you all for being here and presenting this. As a member first of the Metro Homelessness Commission and then of the current Homelessness Planning Council, this is great. I think these recommendations serve us well. I feel like it's very validating as a member of the Planning Council, because I think that body has also agreed that this is ultimately a question of will. And Dr. Shen, who has been a long-serving member of that, I think can speak both to changes in VI Spadat, and Councilmember Allen, we've actually talked about that in the Planning Council context about improvements to that measure, but also to the importance of generating permanent supportive housing. So I think there's a lot of validation in that. I guess I have a couple questions based in, I apologize for coming in late, but my questions are about the part I did hear. Speaking in data, I know we've had huge strides in improving our delivery of HMIS. And I heard the part about the hole in data. I heard what it wasn't, but am I correct in saying even if it's not specifically and unilaterally the mission, that there is, like, can you help me understand where you did see the biggest hole in data?
So one of the biggest holes in data, and Sam, I think, reviewed more with Greg, who did the data analysis and couldn't be here today, and hopefully we'll be able to have him call in at a later date. But I know that there is not good documentation of the time that people are homeless. There's also many programs that are with funded agencies, but are also not within the HMIS system. And so even when Mr., go on.
Just to follow up on that, I think, the data that we looked at, and Greg reported, it's in the report, if not on the slides themselves, of the 1,029 PSH placements, over 15%, 156 people, the location of prior entry was unknown or not entered into HMIS. So no credit for all of those placements. 13% came from living with family or friends, not literally homeless. So that's also excluded. So you're losing already there 28% of the work because of the gaps in the data. So that's why it's so essential.
Got it. No, I understand that. I think one thing we've done, just so other colleagues are clear, is through the HMIS oversight process, we have done huge work on getting up to the point where we have secure data sharing, which a lot of partners and providers were eager to get to, that we've worked on release of information that was not up to date. So we've tried to correspond to HUD best practices on that. So I do want people to be aware that there's work that's gone into improvements in the data, but it is helpful to know where the existing gaps are.
Councilmember, I was just going to draw your attention to kind of the reason that it's important for all of that, because as Sam mentioned earlier, when HUD looks at a system performance when making awards, it definitely makes a difference. And so we pulled together some data from other COCs across the country, and it's up there. And if you look at the award size, there are some continuums who have prioritized homelessness, chronically homeless, documented it, such as New Orleans. New Orleans has a population of half, basically, of Nashville, and their total award is over $26 million a year. But if you look at their chart, they are way ahead. They move they really move the needle on targeting chronically homeless. Birmingham, a similar town, and that's a big university town without the great country music, but still a university town and somewhat smaller, also able to move the needle effectively based on targeting permanent supportive housing, and their award is almost $10 million. So
and compare that to Nashville's.
I can't read the slides.
Nashville's number is about $6.5 million. So when you compare to a city, when you compare to New Orleans, which is almost about 60% of the size of Nashville, getting $26 million a year, and Nashville getting almost $6.5 million, and a lot of that being because of these data gaps. And yeah, you're correct, Council Member. Of course, there's been tremendous progress, but one of the things that during the conversations we've been having with folks, and I'm not going to say who, but I remember a conversation where someone said, yes, I'm trying to get my staff to get this implemented, and some of them think it's kind of a pain. and it's so you again, you've got to acknowledge those growing pains, because we're dealing with human beings.
Absolutely.
And again, to Councilwoman Hurt's comments about accountability, it should not be seen simply as going through the motions, as a lot of HUD programs and a lot of HUD guidance often is seen as box checking, right? There's real demonstrable impact to using these best practices that will make their lives better, that will get Nashville more resources, and ultimately make the lives of the people who are homeless in Nashville better.
Right.
So, but that's not being clearly communicated all the time. Sometimes folks get, oh, you're just asking me to do this it's make work, and it's not. It can make the work.
Yes.
And when I was an agent, when I ran an agency, I was when actually HMIS first came out. I ended up replacing my own data system with the HMIS system to use it as a marketing tool, so that when I went to go meet with Chase Bank for a grant or with Bloomberg for a grant, I could say, this is how we move the needle over, this amount of time. I have this many people that moved into permanent supportive housing. This percentage of my population increased their income. This percentage of the population was connected to mainstream benefits. All educationally, you can track everything, and I think as a system, we need to be able to train people and be able to, so part of the next steps is a deep analysis of the data, figure out who's doing well, how we can incentivize it, and how we can make that better.
No, I appreciate that. I mean, that's, again, we tried to take a data-driven approach specifically over the past few years. So again, I see a lot of this as validating that, and now we need to get even more buy-in throughout the community. Second question is, I think you'd see a lot of consensus about the overall recommendation of the idea of having a standalone department, right? There's been discussion in the Metro Council, there's been discussion in the Planning Council with the Mayor's office, and then you probably see some agreement about the opportunity to further refine the way the Planning Council is structured. As this report comes out, I'm interested in the dynamic of, over here, we're going to look at the potential reform of the Planning Council itself, and over here, we're going to have this standalone office, but ultimately have the accountability flow to the Mayor's office, as opposed to an accountability structure that is more based, in a commission or a board or a council or whatever. And I'd just be interested in the reasoning behind that.
So the continuum of care structure in most other cities, the lead agency has HMIS coordinated entry. Often they have outreach and a few other services. In its best iteration, they are never competing with the membership for grants, et cetera, right? So, but they almost always, so if it's a nonprofit that provides that, then that nonprofit has its own board who is responsible for hiring, and then the leadership of that works with their governing body to implement the strategic plan and to institute technical assistance, for best practices, to bring in other funding opportunities to better braid everything and create an effective strategy for serving the homeless population. So the governance body is generally never the governance of the continuum, and they themselves are answerable to the continuum membership, funded or not. Every single person, every single agency who is a member of the continuum of care should have one vote within that council, and that is the will of the continuum of care is spoken through the board, through the governing body. It's not a management body or a punitive body. It is a governing body, and it is a partner in the implementation of driving change, of driving performance, of driving collaboration, of driving inclusion, of creating safety, of creating equity, of making sure that it is a healthy system where everybody feels like they have an equal voice.
I appreciate that. I think the thing I want to be cautious about going forward in evaluating these recommendations is I don't want us to wind up in a spot where we have a community-based strategic plan and then a political dynamic that does not adhere to that plan.
Yeah.
And then the part about that is right now, as Sam mentioned earlier, we've got to look, we're recommending that y'all look at this in 2 phases, right? There's an immediate crisis happening right now, right? What's happening in your homelessness camps, it's a public health crisis that combined with the statewide political issues that are the elephant in the room, meaning that there's a need to act swiftly and decisively, and to also ensure that there is proper integration with the community and accountability, right? And so the mayor's office has stepped up and said that they will take that weight. But there's a real need to make sure that what the system looks like down the line is absolutely up for debate and discussion, right? And so how you can further integrate that down the line is something that will be happening and has to happen in phase 2. But for now, the immediate recommendations have to be, people have to make decisions, and they have to own those decisions, and they have to be responsible for the consequences of those decisions. And community has to be brought to the table. The council has to be better integrated. They have to be clear about their authority. We have to deal with the structural problems, the systemic problems that body has been struggling with. Again, we talked about lack of diversity and some of the hostility. Those things all need time to be addressed, and then there can be another examination of how these work together. And I believe, and we believe, that once y'all have taken those steps, Nashville can make changes down the line. None of this is going to be set in stone. None of this is set in stone. That is one of the messages we want to make sure people hear, is that we think we know, and you all have said that the people of Nashville and that you all are ready to assume this responsibility. And so what we want to do is make sure that you can address the crises in front of you and then build a new system that will allow you to navigate these issues moving forward.
All right, I appreciate that. My final comment, thank you, Mr. Vice Mayor.
May I just add one thing to that?
Yes, please.
I'm sorry. I think I don't know how you all hear this, but these are recommendations in principle. They're not prescriptive, like this is the way to do it, because different communities organize leadership and accountability in different ways. Some communities, Milwaukee, for example, has the housing authority as the lead of the continuum of care. In Bergen County, where they've also ended chronic homelessness, the COC is the lead agency. So, always with the city partner, sometimes direct. I guess my one recommendation is seeing effective implementation of leadership accountability is that the agency that's going to lead this should also have resources rather than just be an administrative oversight body, that they're actually holding on to something that the community values.
I appreciate that.
And the mayor's office has committed the resources to the body, and then when you get the full PowerPoint for today, it does show our next steps. It does show our recommendations for what we need to do to get more information. I was just lucky enough to be in Santiago, Chile, where they are rewriting their whole constitution, but I got to talk to an architect there who does a lot of the public housing, and he said something that I thought was really important and insightful, and that when he gets, when he's told by the government, you need to build this, whatever, and he says he spends 2 weeks, sometimes 2 months, listening so that he knows the right questions to ask. And that is really what we are trying to do. We are making recommendations based on what we see so far and what we have heard so far, but, there's not going to be a mayor's office of homelessness that's going to pop up tomorrow. And that office is always and forever connected, braided with the governing body, and should be altogether braided with the agencies of the continuum of care, representatives from the state, representatives from corrections, representatives from all of the faith community, business community, everything that is needed in order to create a healthy and robust system of response to homelessness.
I appreciate that, and thank you for that. My final comment is just on the nature of the concluding remark on unprecedented. The permanent supportive housing project we're going to break ground on next week was actually funded last term with an unprecedented $25 million in local funding commitment. We don't have the luxury of counting on one-time federal funds year over year, and so it is unprecedented, but I do want to make sure that going forward, we're in a position as a city to make the ongoing local commitment to hit our PSH targets we're intending to make.
And that's one of the reasons that the mayor's office decided to make it a loan program, and I should have been clear, aimed at filling gaps in projects that are already ready and rolling so that the production begins immediately, and to create a stream of program income that continues to be able to be poured into this specific issue that,
An additional income.
An additional income, yes.
Thank you, Mr. Vice Mayor.
Councilmember Druffel.
Thank you very much for being here. And a little bit of a specific question. So when you have an encampment that's been around for a while, which is an endemic of the chronic homelessness that you're talking about, what is the best approach to solve that problem? Clearly, Housing First is a critical component to that. But in what way and what priority do you handle solving that? Because you have multiple issues with addictions, et cetera. Is there an approach that you would recommend in those situations?
So I'm going to let Sam talk more, but I would say that Housing First, housing is health. Housing is the answer. If you ask anybody out there, it is what they need, and the services that are needed to provide it. I know that you mentioned substance abuse. Sam's team, once again, we believe that you can house somebody that's in active addiction, and perhaps once they're housed, we're talking harm reduction, and they are safe and they feel comfortable, then they can make the choice to do something about their addiction or their alcoholism, right, or become stable on their medication for whatever reason, but they need housing first to do it. And
right. I think the question, you're absolutely right, and I totally agree and understand that format. So yeah, let's say you have 50 people in an encampment. Do you prioritize to get all 50 solved first as part of that encampment? Or because if you don't, it's a very fluid situation, right? So is there a perspective from your side on how you handle this? Let's say there's 5 encampments, so you just try to go encampment, or is there a particular process.
I mean, HUD actually and NAEH both have guidance on encampments, and you must have a place for them. And then I know Sam wants to talk, but nationally, I know there's a will here to keep encampments open, and you should never just move people around.
Right.
But the truth is, it is a best practice to move people out and into housing. And Sam can talk more about how.
Okay, thank you.
Well, it is a best practice to move people out. The question is how.
Yeah.
Right.
You know, do you call the police and sanitation, or do you have an enhanced outreach and engagement process? And I think that the enhanced outreach process is really a relationship building, so you get to know who is in that encampment, and you work with the people that want to move out first. I mean, some people may not have benefits, they won't be able to, they don't think about what the rent expenses are, there could be mistrust. You know, often the outreach is an offer to bring the person to a shelter or to treatment, which, you know, outreach is only as effective as the product they're offering. I think why Housing First works is that if your outreach worker is directly connected to a housing application, then you'll have more people in the encampment willing to leave there for a better place. So that it's really, you know, there's not a particular sequence to it other than the composition of the people who are there and who wants to move more quickly. You want to create a sense of movement out of here is possible to a better place. And then the recurring visits, assertive, daily recurring visits of the outreach team trying to engage more people in whatever it is that's in the way of housing, whether it's getting IDs or benefits or entitlements in place or actual access to some of those 18 housing vouchers and assistance in making all that happen is probably your best way to go.
Right, and then there's choice. And as you read all of our recommendations later on in the full report, you know, one of the recommendations is to increase the tenant base and scattered site availability of apartments, because like anybody else, people want to choose where they live. They don't want to be told, oh, you have to live over there where, you know, you only have 3 choices because this is what our homeless housing looks like. We're talking about integrating people into society and the development of scattered site approaches and using tenant-based subsidies as PSH to make sure that if for any reason this person doesn't work out in this one apartment, that their subsidy will move with them to their next place, and that they are not dependent upon whoever manages their first PSH placement for continued housing, you know, for the rest of their lives. So that
is there, and this is the last question, but it's sort of a follow-up to that, is there ever a point that some do not want to move out of and go into permanent housing? Do you have any experience with that? And I only know because I'm very aware of a Marine that's been around for 7 years, work with him all the time in a place I teach, and he has no interest in going into permanent housing because his experience in distrust is in nature, and that's where he wants to be. Do you have any experience that says maybe there's 10% don't want to come? I don't know. I'm just saying, I just sort of wonder if there's anything there.
Yeah, I mean, I think it's possible. You know, I think that, you know, when we talk about success rates for a Housing First program, we're talking 80 or 90%. So 10 or 20% are either going to try the apartment and leave, or try the apartment and not be able to manage it well because friends come over, you know, a million different reasons. But there's no 100% solution for any of this.
Right.
I think in the case of the Marine you're talking about, and the mistrust that they have of the system, I think that's a relationship building issue. You know, like someone has to go and win that person's confidence over time. I think most people want to move out of a campsite and into housing, but some won't, and it'll take a lot longer, and I think we have to be flexible enough to allow for that rate.
I had one gentleman, a lot of the homes in New Orleans the apartments are duplexes, so there's like a little backyard. And I had one gentleman, and I said, well, you know what? Let's just move your tent into the backyard, and you can, but that was after working with him for a very long time in order to build his trust. And I will say, I do think you have some great outreach workers here in Nashville that do have trust. And I'll even say that the Nashville quality of life officers that I have been out with are superb, and the people there talk to them and trust them. So I think that you have a lot of what's needed. It's just about the will to make it happen.
A peer veteran, someone who's been homeless and is now housed,
that's so important.
Introduce to this Marine to say, hey, I've been where you are, and it doesn't have to be this way, is another way of building some trust and accountability.
Thank you very much.
Yeah, peer support recommendation is definitely in our report.
All right, I've got still two council members in the queue. Councilmember Evans, you're next, and then Councilmember Hauser.
Thank you. I'll be very brief. I think I heard you mention this on the Planning Council makeup. Yeah, you spoke about diversity. Did you speak about function of the roles? Did I hear part of that said earlier?
Committees and.
Okay. Yeah. And so is that something that's right in your report where you will outline, here's all the different functions?
Yes, ma'am.
Okay. Very good. Thank you.
All right. Councilmember Hauser.
Wait.
First, I am so excited you guys are here, and excited for the fact that Nashville has said we do have the will. We have the will, and we're ready to look at this honestly and take the steps that it needs, recognizing it's not going to be a year, 2 years, 5 years, 10, 20, 30, 50. It's going to be something we start today and that we build on. So thank you very much for the work that you've done and for all the nonprofits and neighbors that have been involved in this process. That excites me. I have a few questions. I'm just going to mention them and then make a comment. When you speak to lack of providers, I assume you're talking about social workers. And so but that's not true. Just who do you mean by the lack of providers?
Well, I would say agencies that embrace a housing first approach, a harm reduction approach.
Okay.
This is very much a values-based program. I'm not sure if that's come across, but it's very much client-driven. It's harm reduction, and it's difficult to run because there's house calls. It's not an office-based clinic-type model.
Right.
And so it's one thing to have staff willing to do that kind of work, but the entire agency culture needs to support that because the program is going to be operated by an agency. So in that context, I think that's why it becomes that agency and then the COC and then the city council, it becomes a community, reverberates that way. So it's not just a professional staff member issue.
It's everything, okay. Mm-hmm. And then when we talked about vouchers, and I know that you've talked about the numbers that could be allotted each month to the homeless, but when my day job is I work in affordable housing, and I know there are so many people that need vouchers, and they say they qualify, but there are 1,000 people in front of them.
Right.
So can you speak to how we can get more vouchers in Tennessee so we can take care of these folks?
Well, that's a different problem. So it's vouchers, the federal allocation, increasing the federal allocation is a big concern that's happening nationally, and there's a lot of energy around it. I mean, there's been actually in the last couple of years legislation that's been authored in response to COVID, in response to the housing crisis, to increase those, and we've just had actually political issues. There's a lack of political will at the federal level, literally actually in Congress, to get those bills moving. We hope that's going to change. We expect to see some legislation this year, as a matter of fact, that will actually look to increase, and there have been modest increases in the voucher allocations, but when you look at what's happening nationwide and when you look at what's happening locally where you have landlords constricting, that's why on the affordable housing side, and when we look at the unified housing plan, you've got to start talking about a policy framework, right? You've got to start talking about things like saying that your landlords can't discriminate against source of income, and saying, I will not take someone everyone who has a voucher, right? And getting them, and also having the program and be administered in a way where that insistence is that you look at a voucher holder is backed up, that there are incentives, that there are ways of making sure you recruit more landlords, but you also have to train those landlords. When we talk about this equity analysis and this emphasis on equity, folks really do need to understand that people who have been housing insecure have been traumatized by it, and that's not something that the average person, even when they themselves have dealt with it. Y'all here in Nashville, y'all have had a number of crises, from the tornadoes to the pandemics, and a lot of people don't understand that they have been not just the fear of the tornado, but the destruction of your home, the loss of your home, the powerlessness that engulfs people. And that what happens with the most vulnerable is that they are constantly bombarded by that. Right. Constantly, right? Whereas for someone, they might be able to get themselves through it after the tornado passes, after the pandemic passes, if they get the right support. Sometimes they don't. They fall deeper and deeper into it. And so you need a system that is prepared to address that. And so, yes, we want to work on the most vulnerable. Your homeless are, especially what's happening in Nashville right now, again, what's happening in some of the camps, that they're the highest need, but there's a real need to change the housing system so that the homelessness piece becomes fewer and fewer because there's less people falling into homelessness.
And I would say, since I do have some experience on the landlord side, is that when we talk about incentives to landlords, it's not just dollars.
Correct. Right.
It is much more than that. I as a landlord, if my tenant is having an issue, I need to be able to know what resources to reach out to, or otherwise I'm going to say no to the next person.
That's right.
So please do include in your suggestions what kinds of support, even if it means like a landlord roundtable quarterly or something to share how we deal with situations and what resources are available. Because I think everybody wants this to be successful, but we have to look at all angles of it. My next question has to do with, I know that we're talking about the various programs we want to do, and as a council member, what I would ask is for you to please share with us timelines, what are expectations, not that we're going to beat on anybody's head if we don't make it, but that we know what worked, what didn't, and what are we going to do next. So we're all involved in the process. I think the communication with the council members and with the general public, because the general public will support us if they know what's going on and where are we in the process. They don't want to just see a newspaper article that says, splash, we're doing this great, fantastic program, and then nothing else. They want to know, okay, we're 4 months in, this is where we are now. This is where we thought we would be, this is where we are, this is what we learned, this is what we're doing next. So if we have that free flow of information with the council and with the public, you'll find great supporters. If we don't have that, then only the naysayers will come forth. So thank you so much. I do appreciate you.
Thank you, Councilmember.
All right, Councilmember Withers.
Thank you so much, Mr. Vice Mayor. I wanted to follow up on something, I think on Councilmember Hauser's line of questioning just a little bit. I know several of my council colleagues have been much more involved in the planning council and things of that nature than I've had the opportunity to do. But I think to this issue of trust and building trust through communication, I'm aware that we've had what I would describe as some really unfortunate communication, people passing each other in communication with regard to, for instance, clearing of encampments and things of that nature that have gotten really heated. Right. And I think even today, we knew about this meeting that had been scheduled, at least on the council side. The newspapers, the general press is sort of reporting draft recommendations from the report that I read about this morning in the newspaper. And I'm just a little bit maybe concerned that I think a lot of folks who have been following this issue and participating in it for a long time might kind of feel a little bit like the fact that the press is reporting on direct recommendations before anyone on the Metro Council has seen them, or even before other community of care members have seen it. I just worry about that sort of exacerbating that issue of a little bit of mistrust that we might have draft recommendations coming out to the press before the really engaged stakeholders have seen it.
All right. Thank you, Councilmember Withers. Any other council members have questions? All right, I've got two quick ones, and then I need to kind of say where we go from here, at least how to get some information, particularly from the general public, if there are questions. First, and this is to follow up on Councilmember Hauser, the voucher program. How do you make sure that the voucher program actually works? And I don't mean because we have 18. I'm talking about how do you make sure that in working with landlords,
right,
that all of a sudden, you give a $1,000 voucher or a $1,200 voucher, the next time, in order to really make it work, you give a $1,500 voucher.
Yeah.
And then the next time they want more.
No, that's right.
So how do you make sure it's controlled properly?
Okay,
Yeah.
you go first.
No, you can't. No, you're exactly right, Vice Mayor Schulman. This is something that becomes a problem.
If it's easier, you can look out that way and I'll listen to you.
You just listen.
Yeah.
This is an issue that is a long time problem, right? Because what ends up happening is it goes back to the original iterations of this. Anybody remember the Section 8 certificate program, back when it used to be called the certificate program and the voucher program, and how, you have landlords long for the days of yesteryear when the certificate program paid all of these money. And one of the things that we found is that we were overly incentivizing, we were actually leading to the stigmatization of voucher holders in subsidized housing and how some of these programs were being administered. While Sam is correct, you need to be talking about incentives. You need to be making sure your landlords are heard, that there are supportive services, to Councilwoman's piece, the notion. But we also got to remember that this is a business and that they need to be accountable to their client, and that the government is not their client. The renter is their client. And instead, what's happened is that there's a perverse commodification of the renters themselves, right? And that the government is the client, that the landlords think that they are in a relationship just with the government, and that they then get to be indulged, and that the people are somehow the product that's being sold and moved around and they're being compensated for. And so that's a systemic change. So you've got to start with saying, we are here to help the people that we want to serve. They need help. We recognize that housing must be provided for all and that they qualify for this program. And you, landlord, have the opportunity not just to be a good citizen, but to also make money. And that business model that's not inherently problematic, but it also can't be that you come into it thinking that these folks are trash, because they're not.
Yeah.
They are not. They may have been traumatized. They are not trash. And if there are problems, number one, this is your business. And what I always say is that being trifling, the kind of stereotypical behavior that is often ascribed to low-income renters, is something that you will find. Anybody who's ever been a landlord before, heck, anybody who's ever been a hotelier before, rich people tear up people's stuff more frequently than poor people, actually. So this notion that we have as a country that folks who have vouchers, who need subsidized help, are somehow a bigger risk than the business that you are in is a problem. Now, again, does that mean that people who've been traumatized don't cause confusion in the properties? Of course they do. And one of the things that we've been talking about for years, that's what case management is for. Also, case management, because as I mentioned earlier, trauma can happen a number of different ways. How many of you in the last couple of years didn't feel like you needed to talk to somebody over the pandemic? Right? So trauma comes in different ways. So, Vice Mayor Schulman, to your point, you're exactly right. There's a real need to ensure that you're not conveying to landlords that, well, you need to come and join this program and we're going to overcompensate you because these people are problems. That's what you need to make sure. You need to make sure that they're heard, that the landlord's needs are heard and addressed, and that you have a system that recognizes the value of the people of Nashville and their needs at the same time. And that's what these recommendations have, and that's what this Housing First concept has boiled down to, is making sure folks have the things that they need to be successful, including the landlords, who are an integral part to any successful program.
Okay, thank you. All right, one last question, and I really appreciate that answer, and we're going to have to keep working on that, I think.
Oh, yeah, no, I wish it could happen tomorrow, but.
I wish it could too, but it's obviously very, very important. Okay?
But
All
it
right.
requires some education. And I think with an organized collective impact group, we can get that out there.
Well, I like the collective. Everybody needs to be working from the same page.
Right.
Okay? All right, so saying that and going back, I think, to maybe a point that Councilmember Withers was mentioning, and Councilmember Hauser and everybody else, Councilmember O'Connell, and there are people in the back of this chamber that have been working on this issue for many, many years. And there are people in this council that have been working on this issue for many, many years. So the question, and you may not be able to answer this, but why is this one going to be different? You know, why are now? What is so unique about right now? And there's a will. I mean, we understand that. There's been a will from people in the back for years to get this thing squared away.
Right.
So why all of a sudden now is where I think it's going to be different? Are we going to be, I won't be here 20 years from now, but are there going to be people here 20 years and there's going to be another group and going like, you know what, we're going to get this now.
Right.
Okay.
So, I mean, as to why, I would say the will has a lot to do with it. Take a look at Milwaukee. I mean, there were people in Milwaukee with the will that had been working at it for years and years and years, but Milwaukee decided to take the county city government decided to organize it and take responsibility for pulling together a collective to make it happen. Because there can be will, but if there's no organization, if there's nobody driving it and working with a council and all the agencies to make it happen, then things tend to fall by the wayside and become siloed, and everybody starts doing their own thing again. And so I guess I would say it's always been possible. And as to why it will work now, my prayers are that the will remain and that people will choose to put aside some of their anger and as Richard Cho, who is Secretary Fudge's advisor, said at the Housing First conference in Seattle, he said that he thinks it's time for people to stop talking about why their program and their thoughts are better than everybody else's. And I'm paraphrasing because I don't have eidetic memory, but stop talking about why their program is better or somebody else's program is worse or their idea, and work together with the leadership that exists to make it better, and to do so in a spirit of kindness, and I would add inclusiveness, and offering people the dignity. It's okay to disagree. You just have to do it respectfully. And it's okay to have discussions, but you need to have them respectfully. And you need to make sure that you honor the fact that everybody in every room has their own trauma, whether they come from privilege or whether they come from a homeless camp. Everybody has their own trauma. And you need to be aware that anything that you do could have an effect on those people. So let's move together in a sense of camaraderie and of colleagues, not of robots, but of colleagues, each with our own responsibilities, but let's figure out what they are and move forward to make, with the will to see the outcome, not to be right.
All right, thank you. I very much appreciate that answer. What I will say is following up with Councilmember Withers, we want transparency in this process. And what Councilmember Hausler said was, I think, was exactly right, and that is, we need to stay on a time frame. We need information, and we need to see steps. We need to see people coming together. You've got a tremendous group of people sitting in the back of this room that are going to have to be a part of this. You've got a council that has to be a part of this. You've got a mayor's office that has to be a part of this, along with the departments and agencies. But I think Councilmember Hausler was getting to the point, and that is, we have to start moving. And there has to be a will, and there has to be people all getting on board.
And a sense of urgency.
And a sense of urgency, and Councilmember Hausler has a point, and then Councilmember Toombs, and then we'll end this meeting. Councilmember Hausler, you're recognized. Sorry.
Brian, wanted to add to your comments is that we will stumble. If you're going to do things differently, not everything's going to work 100% as you expect it to. And that is okay. So we don't need to only say what's glorious and wonderful. We need to also say, what did we learn from this? And that's will give us all the courage and the will to continue. But if we're afraid that if we say something didn't work perfectly, that we're going to get slapped down, then we're going to be in a totally different kind of mindset. And so we need to be in a mindset that says, we are going to move forward and we're going to totally embrace this, and some of it won't work. We're going to learn from what doesn't work, and some of it will work, and we'll build on that.
Right.
And if we have that kind of acceptance, then we can move mountains and we can do this. But if we are so afraid that we're going to get fingers pointed at us on anything that isn't perfect, then we're only going to have to do it, and then it won't get done.
I am so glad you said that. One of the recommendations when I outlined the things that, the governing council does, and along with the executive director, is constantly monitor performance. And you take a look at programs that you have worked on and you say, this one, God, this is great, and we probably need to do more of this, but over here we've got this other thing that's clearly not working, so we either redo it or we move money into a place that is working. So it does have to be fluid, and not everything works all the time. And so that is a whole reason for continuously monitoring your performance and the quality of what you're doing. So thank you for saying that.
All right, Councilmember Toombs, you've got the last question.
So I would love to hear some pointers, and it doesn't have to be today, it can be later, from regarding those cities that have ended or have nearly ended chronic homelessness, how they've dealt with NIMBYism. Because I know there's actually a rapid rehousing project that's on the border of my district, and over 100 residents showed up at a meeting very upset that it existed so close to their neighborhood. And I'm not talking about new residents living in the big fancy houses, long-term residents. I know for my district, a lot of folks, when they hear about these types of projects, they see it as, poverty being concentrated in their area. So I would love to hear how you deal with NIMBYism, because I think as elected officials, we all want to help resolve chronic homelessness.
That's both of us. Yeah, that's something else that we've been talking about, the long-term recommendations as well. We want to make sure that Nashville is looking at something called the housing justice narrative analysis, because there's a real problem with how we talk about housing issues in this country. Nashville is not unique. You're not the worst. You're not the best. Everybody is really bad about this, and it's gotten worse. And we can prove it has gotten worse just simply looking at the response to COVID, right? And again, this is just something everybody just fell down on. We had a pandemic that before there was a vaccine, before you could get masks, the only thing you could do was stay home. And we did not guarantee that every American, every Tennessean, every person of Nashville had access to that. And so that's something that we've got to grapple with moving forward, because there needs to be a mind shift. And so that's long-term, and also it helps when the kinds of programs that Sam has pioneered and Stacy's worked on are successful. When you see folks be successful, when you make that investment, because again, what people think is that those, instead of thinking about them being traumatized and how close they are to them, everyone tells themselves, oh, something's wrong with them. That's why they failed, and that's why I will be different. If the worst happens to me, they don't understand that those folks have been traumatized, that they can be traumatized, and many of them have been traumatized, and they've just not gotten the help necessary. So there's got to be some success, there's got to be some victories, and then there's got to be a concerted will. And I also got to also come back to y'all's unified housing plan and the work being done out of the planning department. A lot of this stuff is bad. It's bad systemic zoning. It's racist zoning that needs to be undone. And again, you have to have those conversations with communities who are seemingly trying to protect redlining, modern day redlining, because they think that that's going to protect them. When again, the data shows that particularly amongst communities of color, that bias bleeds into everything from the valuation of their home. And it's not because poor people moved in, it's because the system has been rigged to devalue them because of the color of their skin. And so we've got to have that conversation and make sure people understand that, and then move forward. But that's a long-term, hard fight. But again, victory.
Oh, I'm sorry. I didn't mean, because she is so right. And but we do plan to have more focus groups where we plan to invite some of the national people from Milwaukee, people from cities where they've made certain things work. So we're going to get these national best practice to come in via video or in person to tell us, and for us to be able to learn from what they did. And not everything will work here because, but everybody says, oh, our city's different. Every city's different, but every city is also very much the same. And there's a lot to be learned. So that is our intent. We are currently lining up national experts, other city leaderships where they've made tremendous movement in best practices to come in and talk to us and be part of the dialogue for Nashville Davidson.
I just have one comment about that building, which I don't know, but one of the things that happens often, especially in rapid rehousing programs, is that there are insufficient support services for the people that are in the building. Yeah. And then the building does become actually a problem in the neighborhood. So that, it's this Housing First program we're talking about talks about robust service support so that things don't get out of hand.
All right, I think that's it for now. This conversation continues. I will tell you that it's my understanding that you all are going to be presenting at the next Homelessness Planning Council meeting. So I'm not exactly sure how that's going to work, but people are certainly welcome. That's an open meeting. That will be the second Wednesday in June, which is first, it would be June the 8th, I believe.
I'd like to make a request to find a place where we can video Sam and Andronika in.
Okay, so I'll work with April on, we may be able to have it here. All right, we'll see if we can do it here. The other thing is, particularly for, that's for everybody, including the individuals in the back of the room, if there are, if you all have questions or if you have comments or you want to make statements about the plan, Ginger Hauser of the Mayor's Office has agreed to take any questions or comments that you may make. Ginger is Ginger .Hauser, HAUSSER at Nashville.gov. Ginger.Hauser@Nashville.gov. I won't give out her phone number, but if you have questions or comments, and if you forget Ginger's email address, send them to me or a council member, and we'll send them to Ginger, okay? So we have obviously lots of work to do, and I think there's a will. Let's see if there's a way, all right? So anyway, thank you all for being here. We very much appreciate it, and my guess is we'll see you all very, very soon. Yeah. All right, thank you all for being here.
Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.